The central takeaway of our study is that self-reported menopause stage is frequently inaccurate, even among women actively seeking women's health care. Our findings, consistent with large population-based studies, demonstrate that relying on self-report or age-based cutoffs alone can misclassify menopause stage, particularly during the clinical midlife transition years, potentially leading to missed opportunities for prevention and timely intervention. My name is Dr. Jewel Kling, and I'm an internist in the chair of the Division of Women's Health Internal Medicine at Mayo Clinic in Arizona. I'm discussing our study entitled Accuracy of Patient Self-Reported Menopause Stage, a Cross-Sectional Study, which will appear in Mayo Clinic Proceedings. In our cross-sectional study of more than 3,400 women aged 40 to 65 years of age that were reporting to Mayo Clinic, patient-reported menopause stage aligned with clinician-determined stage only 57% of the time. Over 1/3 of the women reported being unsure of their menopause status, yet most of these women were classified as postmenopausal by menopause-trained clinicians using standardized assessments. And the gap between self-reported and clinician-determined postmenopause widened progressively after age 50, highlighting significant gaps in menopause awareness, even among midlife women seeking specialty care. Our findings parallel prior international research showing the limitations of self-report and age-based classification alone. Clinically, these findings reinforce that menopause stage cannot be reliably determined by self-report or age alone, especially during the 45 to 55 year age range. While precise staging may not always be required for symptom management, it's critical for assessing long-term health risks, including cardiovascular disease, bone loss, and metabolic changes. Therefore, clinicians should proactively assess menopause stage in their women patients and incorporate education into routine care rather than assuming patient awareness. For patients, this study highlights that uncertainty about menopause stage is common, even when clinical evidence supports postmenopause. So if that's been your experience, you don't know where you are in the menopause stage, you're not alone. Improving understanding of reproductive aging, including the timing of menopause, symptom patterns, and health implications, can empower women to seek appropriate care, engage in informed decision-making, and participate more actively in preventative health strategies during midlife. Future research should focus on developing more reliable and standardized menopause phenotyping tools, particularly those that integrate clinical data, symptom patterns, and electronic health record information. Now, what's fantastic is there's these emerging approaches using artificial intelligence and machine learning, which hold promise for improving menopause classification at both the clinical and research level. Additionally, studies in more racially and ethnically diverse populations are needed to validate these findings and to better understand how menopause misclassification affects care, outcomes, and health equity. Thank you so much for listening. I hope you'll open the article and take a look at it so you can get more information and further details.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.